Hey, welcome. We're told all the time that clean water saves lives. But have you ever wondered by how much? Can something we take for granted, like a clean glass of water, actually change a child's future? Well, today we are unpacking a really fascinating study from Pakistan to find out. Let's dive in.
So, this is the big question we're tackling today. Is clean water just a small piece of a giant public health puzzle? Or is it one of the most powerful tools we have to improve a child's health? The data, it turns out, has a pretty clear answer. To really get a sense of what's at stake here, let's just start with this number 1.2 million. That's the estimated number of deaths from unsafe drinking water in a single year. It's an absolutely staggering figure, and it shows you just how big this global crisis really is.
And this isn't some niche issue nobody's talking about. It's so critical that the United Nations has made clean water for all a core part of its sustainable development goals. It's basically the world acknowledging that safe water isn't a luxury, it's a fundamental human right.
Okay, so from that huge global picture, let's zoom way in on our case study for today, Pakistan. Now, as the world's fifth most populous country, we're talking over 235 million people. So the challenges here and the solutions are just massive. So Pakistan is facing this kind of dual challenge. On one hand, you can see here that rates of malnutrition have definitely improved since 1990, which is great news. But look at those 2017 numbers. 38% of kids under 5 were stunted, 23% were underweight. The progress is real, but the fight is so far from over.
All right, before we get into the nitty-gritty of the study, we need to get on the same page with a few key terms. First up is stunting. Now, this isn't just about being short. It's a sign of long-term, chronic malnutrition that can impact a child's brain development and their future for the rest of their lives.
Next, we have underweight. This one is pretty much what it sounds like. A child weighs too little for their age, and this can signal either a recent illness or a more persistent lack of nutrition. It's another super important health indicator.
And finally, there's wasting. Now, this is the most dangerous one. It's a sign of severe acute malnutrition, meaning a child has lost a lot of weight recently. It's a life-threatening emergency. Really try to remember this one because it becomes super important later on.
So the big question is, how do you even begin to prove a link between something like water and these health outcomes? Well, these researchers basically became data detectives. They dug into this massive data set covering 117 districts over a span of 8 years, looking for patterns and clues.
So, where did their investigation start? Step 1, map out the problem. They asked a simple question: where is access to clean water the absolute worst? And right away, the data showed a huge geographical divide.
And boy, did the map tell a clear story. It pointed straight to one province in particular, Balochistan. This is the most deprived region, and get this, in some districts, clean water access is as low as 12.68%. That's less than 1 in 7 people. Just let that sink in. Okay, so you've got this map showing a huge water inequality. The next logical step for our detectives? Overlay another piece of data. They asked, where is child stunting at its worst? And when they mapped that out, the pattern was just tragically similar. The overlap was just undeniable. The 10 districts with the absolute worst rates of child stunting are all located in those same water-deprived provinces, Balochistan and Sindh. And in some of these places, the stunting rate is over 60%. That means more than half the children there are suffering from chronic malnutrition. But look, seeing two things in the same place on a map is a huge clue, but it's not proof. To establish a real mathematical connection, the researchers had to bring out the heavy-duty statistical tools to make sure they were really isolating the impact of water. So what did the numbers actually say? Okay, so first up, after all that digging and analysis, what was the actual real-world impact of improved drinking water on child stunting? The result was pretty amazing. For every 1% improvement in a district's access to clean water, the likelihood of child stunting fell by 9%. That's not just a correlation. That's a powerful, direct link. Okay, that's a huge deal for chronic malnutrition. But what about being underweight, which is a more immediate measure of a kid's health? And here, the effect was even more dramatic. That same 1% increase in clean water access was linked to a massive 20% drop in the number of underweight children. I mean,
That's just incredible. It suggests that clean water has this immediate, profound impact. But remember wasting, that most severe form we talked about? Well, this is where the story gets a bit more complicated. The researchers found no statistically significant link here. That suggests that wasting might be caused by more immediate crises, like famine or a disease outbreak, that clean water alone can't fix. It's a really crucial and kind of humbling finding. But they didn't stop there. The researchers uncovered one final critical layer. When they split the data between rural and urban areas, the difference was like night and day. In rural districts, the impact of clean water was strong and clear. But in the cities, the effect basically vanished. This tells us something so important. The life-saving power of clean water is most powerful exactly where it's needed most, in these deprived, rural communities.
So what's the ultimate takeaway from all of this? Well, the study's own conclusion says it perfectly. They say the findings emphasize the urgency of addressing regional disparities. In other words, this isn't just a story about water. It's a story about where the water goes. It's a direct call to action, and it's backed by some really solid evidence. So let's just boil this all down into 3 simple takeaways. 1, this is a local problem, and the solutions have to be local. Empowering local governments is absolutely key. 2, we have to target rural areas, because that's not only where the need is greatest, it's where the impact is greatest. And 3, this study proves that something as simple as a water pipe is one of the most effective public health tools we have.
And really, that's the heart of it, isn't it? This was never just about infrastructure, about pipes and pumps. It's about potential. It's about making sure every single child has that fundamental building block they need to grow, to learn, and to have a shot at reaching their full potential.
So we end up right back where we started, but now we have a much clearer picture. The evidence is just undeniable. Clean water leads to healthier children. The data has spoken. So the only real question left for us is, what's it going to take to turn all this data into drinking water for every single child?